The phones are ringing, the waiting room is full, and everything stalls out the moment a patient asks a simple question in Spanish. Across the United States, nearly 30 million people have limited English proficiency, and Spanish makes up over 60% of that population. If your practice operates near a major market, a significant portion of your patient base is navigating your front desk with real language difficulty every single day. When patients call to schedule or arrive for an intake without clear bilingual support, clinical workflows immediately break down. A standard 30-minute appointment can stretch out to over an hour and 15 minutes just trying to piece together basic medical context. Unresolved language friction at the front desk costs money. It is an active, unmeasured operational leak, draining your practice's time and revenue. The automatic response is to hire an in-house bilingual medical receptionist. But looking closely at the numbers reveals why that strategy rarely works long-term. A $40,000 base salary is just the start. Adding taxes, insurance, PTO, and training pushes the fully loaded cost over $60,000. With tenure under 2 years, replacing that employee adds a $20,000 to $30,000 penalty. Relying on a single person also guarantees coverage gaps. When your one bilingual staff member takes a sick day, the language gap instantly returns. The data shows that 29% of Spanish-speaking patients do not report resolution of their medical condition when facing these specific communication barriers. Trying to fix a systemic problem by hiring one expensive, difficult-to-retain employee creates an unsustainable financial burden that fails both the practice and the patient. Modernizing this process requires shifting from a vulnerable in-house hire to a resilient outsourced virtual model that integrates directly into your existing phone and EHR systems. This diagram illustrates how incoming calls are triaged. An AI detection node intercepts the first few words spoken by the caller. If it detects Spanish, it routes the call immediately to a dedicated bilingual medical assistant. The patient connects with a professional Spanish-speaking agent in real time. There is no awkward pause, no placing the caller on hold, and no scrambling through the office to find someone who can translate. Pairing instantaneous AI triage with dedicated human expertise neutralizes the primary point of friction before the conversation even begins. Once connected, the virtual agent captures the patient's demographic data. They log the patient's language preference directly into the EHR, ensuring every subsequent encounter starts with the correct context. They also handle insurance verification. Translating complex payer policies, like deductibles and coinsurance, into clear Spanish ensures patients understand their financial responsibilities. Clearer explanations directly improve collection rates. This flowchart maps the virtual journey. After data entry and insurance translation, the system automates multi-language reminders, reducing no-shows. Notice how the workflow splits. The virtual front desk handles administrative tasks, while clinical discussions cleanly hand off to a medical interpreter. A systematized, tech-enabled workflow executes complex healthcare administration at scale. It maintains strict HIPAA compliance across the system, while allowing your dedicated in-house clinical team to focus purely on immediate patient care. Abandoning the in-house hiring model for a dedicated virtual assistant from Staffingly yields a direct financial return. The fully loaded in-house burden of $60,800 drops to a flat $21,600 a year virtually, a 64% reduction. Furthermore, this HIPAA-compliant system deploys in just 48 to 72 hours with no long-term contracts. Over 800 healthcare providers across all 50 states are already utilizing this system to manage their front desk workflows. Upgrading your clinic with virtual bilingual infrastructure transforms a massive, unpredictable operational cost center into a streamlined, highly profitable utility. The dual outcome is clear. Your practice captures more scheduled appointments and retains patients, while simultaneously cutting administrative overhead. To initiate your system upgrade today, start a 30-day free trial at staffingly.com/demo or call the number on screen. Leaving the language gap unaddressed is an active daily choice to leak revenue. It is time to close the gap.